Do you feel perpetually drained? Not just a little sleepy, but genuinely exhausted even after getting 8 hours of sleep? Are you always the person asking for the thermostat to be turned up? You might have an invisible energy leak. I'm talking about iron deficiency anemia condition affecting over 2 billion people worldwide. It's an epidemic of tiredness, and it might be silently sabotaging your health. Today, we're unlocking the secret life of iron. What it is, the 7 surprising symptoms you need to watch out for, including a bizarre craving for ice and the actionable steps you can take today to refill your energy tank. Let's dive in. Think of your blood like a massive transportation network. The red blood cells are the tiny delivery trucks. And what's the most precious cargo? Oxygen. Iron's entire job is to be the essential ingredient that allows those trucks to carry oxygen from your lungs to literally every single cell, tissue, and organ in your body. Specifically, iron builds 2 crucial proteins: hemoglobin for your blood and myoglobin for your muscles. Without enough iron, your body can't build enough hemoglobin. This is when the system breaks down. Your delivery trucks stop showing up, your tissues get starved of oxygen, and that chronic lack of air delivery is what we call iron deficiency anemia. It starts subtly, usually with fatigue and pale skin. But as the deficiency gets worse, the symptoms become weirder and more worrying, because your heart is working overtime trying to pump more oxygen-poor blood. You might feel dizziness, chest pain, or a fast heartbeat. Pay close attention to these 3 unique signs. 1. Extreme coldness, especially in your hands and feet. 2. Restless leg syndrome, that irresistible urge to move your legs, often at night. And perhaps the strangest, 3. Pica, which is a craving for non-food items, most commonly ice, but sometimes even dirt or clay. If any of these sound familiar, it's a huge flag that you need to investigate your iron levels. Why do we become deficient? It usually comes down to 3 main reasons. Number 1 is blood loss. The most common culprit: heavy menstrual periods or childbirth, but it can also be internal bleeding from issues you can't see, like ulcers, celiac disease, or certain medications like frequent NSAIDs that irritate the gut. Number 2, poor absorption. Even if you eat iron-rich foods, conditions like Crohn's disease or stomach surgeries, including weight loss surgery, can prevent your intestines from soaking up the iron. And number 3, increased demand or low intake. This is common during pregnancy, or if you follow a strictly vegetarian or vegan diet without careful planning. Treatment always starts with your kitchen. You need foods rich in 2 types of iron. Heme iron comes from animal products, think lean meat, poultry, and seafood like salmon. Your body absorbs this easily. Not heme iron is found in plants, lentils, beans, spinach, and fortified cereals. Here is the most important trick for plant-based iron. You must pair non-heme iron with vitamin C. Vitamin C acts like a turbocharger, drastically boosting absorption. So, always pair your spinach salad with some sliced strawberries, or take your supplement with a glass of orange juice. Conversely, avoid taking iron with milk, coffee, or calcium supplements, as they are absorption blockers. If diet isn't enough, your doctor will likely recommend an oral supplement, commonly ferrous sulfate. When you buy one, check the label for elemental iron. That's the actual amount your body can use. And be aware, iron supplements often cause side effects like constipation and dark stool. Drink plenty of water and talk to your pharmacist about a stool softener if needed. The path to recovery starts with your healthcare provider. They will order a simple, complete blood count, or CBC, to measure your red cells and hemoglobin. This confirms the anemia, and they may follow up with a ferritin test to check your body's iron stores. Recovery takes time. You likely won't feel better overnight. It usually takes 1 to 4 weeks on a supplement before you notice a real difference in your energy levels. And even once your hemoglobin is back to normal, your doctor may recommend you continue supplementing for another 6 months to completely restock those long-term iron stores. Patience is key here. Iron is more than just a nutrient. It is the fuel for your entire life. If you are constantly tired, don't just blame stress. Talk to your doctor. It might be a simple fix for a massive energy drain. Now, I want to hear from you. What's one higher food you are going to pair with vitamin C this week? Let me know in the comments below. If this video helped you understand your fatigue, please hit the like button to help others find this information, and subscribe for more science-backed health insights. Thanks for watching, and reclaim your energy.